Good evening, everyone. Here are our demands. We would like to start with halt, arrest, and grant personal recognizance so that our loved ones are not being held indefinitely at the intake waiting for court hearings and trials. We'd like to reduce the prison population to control the spread of the disease of coronavirus. Restore lost good time, expedite parole hearings, and release all eligible individuals. Utilize medical parole for all terminally ill, elderly, and uncompromised individuals. Release all other eligible individuals into community confinement. We would like to recognize everyone at the ACI as a priority community for the COVID-19 vaccination with informed consent and opt-out process for the entire population. Provide our loved ones with adequate personal protective equipment, masks, soap, hand sanitizer as recommended by the CDC. Regularly administer universal testing across the population, including asymptomatic people. Provide transparency and accountability to our incarcerated people's families. Publicly release and quarantine plan for staff and incarcerated people who test positive, as well as formal process for family members to report noncompliance. Report daily COVID-19 numbers on the Rhode Island's DOC website and social media. End 23-hour lockdown. It has proven ineffective as quarantine measures, especially as incarcerated people continue to report that prisoners testing positive are being housed with those who have tested negative. Safely restore time out of cell, including access to yard time outdoors to control the spread of the disease.
Thank you for that.
Gotta drop one of these gloves. Thank you. Now I'm going to also read an anonymous statement from someone released from medium security in the ACI in August of 2021. Since his release, he has remained in touch with multiple people who remained in prison in medium security in the midst of COVID-19 outbreak. Those who I speak with inside have reported numerous alarming things in regards to the way COVID is being handled in the ACI. I know from my own prior experiences with the poor medical cares in the ACI that the guards and nurses lack basic care for prisoners. I developed multiple cysts on different parts of my body while I was incarcerated, and there was a period, and there was a period of times where it was too painful to sit during meals. It took 5 months of me standing there during mealtime for the officers to finally grant me medical attention. So honestly, the reports I hear about what is going on currently come as no surprise to me. When I was in medium August of 2020, the population was so low that we were all able to have single cells to ourselves. But one of the many friends inside report that he was in a single cell in medium for many months until November of 2020, when he was moved to a double cell where he contracted COVID. He was kept in the cell sick with his roommate for 3 weeks. In that time, he only got 5 minutes out of his cell to take a shower and then sent back in. They were putting people together when they knew that it was unsafe. They are putting people's lives in jeopardy without remorse, and the only response is to let them get sick and hope for no serious consequences. We know that there are serious consequences though, and we have seen with no multiple deaths of prisoners. Men and mediums currently only get 15 minutes out of their cell in the morning and 15 minutes out at nighttime. They must either choose between a shower or a phone call, and that they were only letting them out in small groups. I highly doubt that they are cleaning the phones and in between each use. If someone can get through to the person they are trying to call, there is no time left for a shower, and there is no time for the men to wash their own clothing and masks out if they want to. Instead, everyone has to put their laundry on a loop to be taken into their washing machine that is overpacked, and there isn't any bleach to be used. Just as a bit of detergent, so that they are often come back dirtier than they were before. The cleaning supplies in the ACI consist of a dustpan, broom, mop, bucket, spray bottle, and some rags, and all of the men you touch and use the same cleaning objects. If they get access to them, often by the time the porters reach the last 20 to 25 cells of a block, there are no supplies left. Many of the men, they have used their water instead of real disinfectant to clean. The correctional officers all hang out in the bubbles together and don't wear masks in there. So even if they are wearing masks around the prisoners, they are likely spreading it amongst themselves and to the prisoners they come in contact with. They aren't taking this thing serious enough. I've even heard of prisoners being kept past their release dates because they are sick with COVID. It is like they want people to die in here. The public needs to hear this, because what is happening is torture. Too many Rhode Islanders have no idea what is going on behind closed door at the Department of Corrections.
Thank you. So we have one more statement from someone who has a loved one inside. I know you can hear us, so listen up. Director Patricia Coyne-Fague and the Rhode Island Department of Corrections. In case you didn't know, we are still living in a pandemic. It has not gone away. Patricia, why are you allowing your COs to ignore the CDC guidelines written to protect the men and women living inside those walls? The same policies that we create to slow down the spread of this deadly virus. The CDC has asked the state of Rhode Island to follow these protocols to prevent the spread of COVID. Let me remind you, you have not taken this pandemic seriously since back in March. The only thing you've done is allow COVID to get behind those walls. It's your job to keep COVID out of there and to keep our loved ones safe. Time and time again, you continue to fail. Your negligence is costing people their lives. Change has to start. It has to start right here, and it has to start right now. Take control over your guards. Tell them that they need to do their jobs. Roll the tape so that you can see with your own eyes that your employees are refusing to follow the state COVID-19 protocols and the Rhode Island Department of Corrections' own policies. We demand that the guards wear masks at all times, frequent cleaning with proper cleaning supplies, stop searching cells with no masks on, wipe down the phones, follow mandatory quarantine guidelines, stop mistreating people who want to stay safe. Their life matters. They're trying to protect themselves because you have failed to do so. Our voices will not be silenced. All right. Does anybody else want to say something? All right. No justice!
No peace!
No justice!
No peace!
No justice!
No peace!
No justice!
No peace!
We demand release!
We demand release!
No justice!
No peace!
We demand release! No justice!
No peace!
We demand release! No justice! No peace! We demand release! No justice! No peace! We demand release!
No justice!
No peace! We'll demand release!
No justice! No peace!
We demand release!
No justice! Oh, my bad. No justice! No peace! We demand release! No justice!
No peace! We'll demand release!
No justice!
All right, I'm gonna just do we'll be back because it's cold. We'll be back! We'll be back! We'll be back! We'll be back! We'll be back!